Good morning, everybody, and thank you for joining November's webinar. So today's really exciting for us. We're launching a new module. We've been working on this for a long time now. It's something a lot of our customers, our providers have been asking for. So we're really pleased to be able to show you it today. So the new module is incident management. So this is about improving safety and support through effective and positive incident processes using iplanit. So this module fits into the iplanit suite of modules. So today we are joined by, there is myself, Terry Langton. I'm one of the project directors at iplanit. And we also have Lisa Jane Humphreys, who's been heavily involved in developing the module with the development guys. She's our client director. So I'll be doing a little short PowerPoint presentation to yourselves, maybe about 10-15 minutes, and then we're going to jump onto the system, and Lisa Jane's going to walk you through a demonstration system of the modules. The module's very configurable, so what Lisa Jane's going to be showing you is the system we have, the demonstration system. But as she goes through it, she'll also be pointing out little bits that are configurable. So just in case, we've got a couple of new people on the call today, so I'll do a very quick introduction about iplanit, what it is, how it works. But as this is focused on the incident module, obviously it's going to be more about that. But just in case you haven't seen iplanit, just to give you a little bit of a summary about it, it's a flexible and modular cloud-based system. So it's designed to help and record all types of support. So it's not limited to learning disability, which back in 2011, that's where we started on our journey at Aspirico, which is the company that makes iplanit. Now it works for providers that offer mental health support or aged care support. It really goes across all different types of support. It's enabling thousands at the moment, thousands of supporters and service leaders across the world. So we're in New Zealand, Australia, Ireland, the UK, to deliver on their promise. So we're a very principle-based organisation, and our goal is to have iplanit help improve the lives, keep them safe from unnecessary risk, and offer appropriate transparency to loved ones. And we think iplanit really fits in to that space. So in line with that, when we look at iplanit, although we won't be looking at that today, a really important part of that transparency is that people supported and their family can also access elements of iplanit and access their plans and outcomes and track progress in their support and lives. So we won't be demonstrating that aspect of it today, but it's an important part of iplanit that people who are supported and their families can also access it and take ownership of their own support through that. So as iplanit's developed over the years, we've been very careful to make sure that it doesn't just become this back office system. It's about people, it's about delivering on support. But as we've developed iplanit and then the architecture of iplanit being around the person supported, this has given us opportunity, as we've worked with providers over the years, to start touching into some of those back office areas that have a direct impact into a person's life. So it's never going to be a financial and payroll system or a HR system. It's never going to be a staff rostering system, but there is a little crossover there. So when we look at the module, I'll show you what modules are available within iplanit. But as iplanit's developed over the years, we've developed these add-on modules based on our relationship with our current customers. Providers have been asking for solutions, and we've developed those solutions. So there are things like referrals, managing funding and contracts, support tasks such as medication and personal care, and making sure these are done and tracked and alerts go off if they're not done. Day planners, needs assessments and risk management. So these are all modules that affect the day-to-day support of the people we support, but also it helps organize the provider and helps give them efficiencies. So there is like a little bit of crossover with that back office functions, and incident management is one of them as well. So I'll show you later in the presentation. It's about those systems that help us free up time, keep us organized, keep us within legislation to make sure we can deliver good support so the person benefits from that in the end. So there is a little bit of a crossover, but as you can see from that list there, as iplanit's developed over the years, there are different versions there. So we regularly update iplanit. We regularly bring out new versions, keep it up to date, add in new efficiencies, new learning as we work with our customers. So you can see that the suite of systems, the suite of the modules has grown and grown. And there's that little bit of crossover with the back office side of things, but ultimately our values are that it helps improve people's lives. But once you start capturing information at the person side of support and it's in a cloud-based system, that helps give you reports. So iPlanet reports can give live and accurate evidence that providers can use to show value to their funders. So it really helps evidence value for money. It helps evidence keep it in line with key performance indicators, and also on an individual level. So that information, so as support is being delivered and a person's outcomes are being reached, that's also being captured in aggregate reports. iPlanet's also designed to be configured to the way your organization works. So we don't use stencils of plans. We arrange our planning around how you work, so that when we come to train iPlanet with your staff, they recognize their plans on the system and they recognize the language that's being used, and also the organizational structure. How we organize the reports for you. So iPlanet's been really successful. It's won 7 international awards. And just coming back to that point I've been repeating, because iPlanet is designed to work around the person, it's not the architecture of the system, the architecture of the software is based around the person. So that gives it a unique positioning where it can work for very, very small providers, but it can also work for national multi-region organizations as well, because it's centered around the person and not the staff. Really frees up. It can be a very, very effective system, both in small and large organizations. We need to, under the pressures that we have today, providers have today around key performance indicators, around compliance, and today, we're going to be looking at incidents. And there's a lot of compliance issues around incidents at the moment. I'll talk about in a couple of seconds. But iPlanet can configure to make sure that as you're capturing support being delivered or incidents being monitored or whatever, then that is in line and can create reports for all your compliance needs as well. It might be worth, if this is the first time you see an iPlanet, it might be worth signing up for our December webinar, which is going to be a general overview of iPlanet, whereas today we're looking at a specific module, the new incident module launch. In December, we're going to be doing a generic iPlanet talk, so I'll show you the whole suite of iPlanet. It'd be a complete demonstration of the whole system and how that works. So if this is the first time you're seeing iPlanet, make sure you sign up for the December webinar as well. Okay, so just give you a kind of like an aerial view of how iPlanet works. That center circle there is the core iPlanet. So when you talking about purchase, so when you purchase iPlanet, you get everything within that core iPlanet there. You get reports, the KPI reports, notes, plans that are configured to how you work. So we spend a lot of time looking at your plans and getting them into iPlanet in a way that makes sense to you, in a way that's efficient, and in a way that your staff are going to understand and can work with. There's document management and workflow. You can upload documents into iPlanet, and there's places to put that. You can upload media as well and pictures and make plans really interesting for people, and sound and videos. There is a dashboard in that bottom left there on the circles that helps the staff member organize all the tasks that he's been assigned or she's been assigned, and helps them organize the priorities and who they're working with and when, and where their outcomes are up to, and whether they have plans and the correct plans and referrals and so on. There's an alert panel which lets you know if anything's overdue. It's particularly useful for managers that if they can see that there are reviews that are overdue, they can chase that up or get that up to date. The alert panels, the incident management module we're launching today also feeds into the alert panel. So as the incidents have timescales too, that certain people need to be notified, you get alerts around that. There are also surveys and needs assessments. So you can have a needs assessment to kind of help pre-fill some of the planning side of things, so nothing is missed in terms of risk and in terms of planning. So that needs assessment is a really, really great module for a lot of different support types, and you would design your own needs assessment and you can help that configure your plan. So I think the main thing is that you can add on these modules around the side. So the core iPlanet, the green circles, is what you would get as part of the standard iPlanet. And then generally a provider would add 1 or 2 modules to it that immediately solves a problem, whether it be referrals at the top there or needs assessment towards the right. There's a calendar as well, which you can share with the person support, which really helps them manage their time. And then support tasks, which are things that need to be done, such as medication or personal care or meal times. If we need to record that these things are being done, or we need alerts to say if they've not been done, there are modules to add on there. And so there's a lot of modules that you can add on. Generally, nobody would add on all of them because it's just too much for an organization to kind of culturally change to or accept. You would generally get the core iPlanet in the middle and then add 1 or 2 modules on top. And then you start to configure your own iPlanet system then. So the one we're talking about today, obviously, is the one that's in yellow, which is event and incident management, which Lisa Jane's going to do the demonstration on in a couple of seconds. But just talking about the incidents, providers have been asking us this for a number of years for us to help them with their incidents, because tracking incidents can be really difficult. Reporting incidents can be it can be difficult to keep on top of in a paper system. So if you have multiple sites or people's houses and you have the incident books in there, having to write incidents down on paper, and then it becomes this static piece of paper in somebody's house or on a ward or in a shared accommodation, but it's not in the central office or the management office of the provider. That can be really difficult, communicating the two and making sure timescales are being kept to. So providers have been asking us for this for a long time. We've actually managed to get this done over 2017, 2018. So just looking at just focusing on CQC, although these principles apply across nearly all legislative monitoring organisations such as CQC or HC or whoever, depending on what country you're in. But CQC has fined care providers $3,750 for failing to report incidents. So they haven't reported the incident to the governing body, which is the CQC, and that's where the fine is. So it's nothing about whether the incident was managed well, whether there was learning from the incident, whether internally everything was done correctly. Because it wasn't reported to CQC, they got the fine there. So that's a system failure. It's not necessarily it's a bad provider covering something up. It's that they didn't do that final step in the system, which was reported to CQC. Next one down, CQC fined a home care agency for failure to comply with the regulations. They weren't able to demonstrate that they'd followed the due processes that are required when a certain incident happens. So again, it's a system-orientated thing. So whilst the support that was delivered might have been great, the system that they meant to follow wasn't, so they didn't comply with the regulations. I mean, just generally over the last 7 or 8 years of engaging with iPlanet engagement providers, there are a lot of providers out there that are giving great support. When it comes to evidencing that support, it becomes really difficult for them because it's such an administrative burden for them to do it. So they could be delivering absolutely brilliant values-led support, but they just can't evidence it well because that administration isn't there to help them. And that's sometimes, that's a quandary a lot of providers are in. I think that's the case with some of these reports as well. So CQC issued a fixed penalty notice following the provider's failure to notify the Commission within the required timescales about incidents affecting people receiving care and treatment. So these aren't reports saying these are bad providers. These are reports saying you didn't follow a process. And this is what the incident management module addresses some of that with alerts. It creates stencils of letters. So when you report an incident, you can create a letter almost immediately that is pre-filled for you so that you can email it or post it to family, to police, to CQC, to the local authority, whoever that needs to be. And you can get that organized very quickly and one point of contact as well, rather than having a piece of paper in a house, having to get that piece of paper into a head office. People knowing the timescales, those things can be really difficult. And then generally in terms of leadership, having the overall picture. So a lot of providers will look at their incident reports that are written on paper and then start putting that into Excel sheets. And that is a really limited way of developing a picture of what's going on in your organization regarding incidents. So getting an overall picture is incredibly easy on iPlanet because everything is centralized and everything is categorized, and then it gives you reports, which we'll look at in a second. But there's, again, some snippets from inspections to provide and not take reasonable steps to identify the possibility of abuse and prevent it, or to respond appropriately to allegations of abuse. So within the incident management module now, you can have, there is a complaints procedure where there's drop downs to say this is a complaint, this is an allegation, and so on. And we can limit that as well. So only managers can see that. So if it's a whistleblowing situation, you can limit it so that not everybody can see it, only the senior managers can see it, or however you create those permissions within the system. So by having that, you will immediately have an appropriate system to respond to allegations of abuse as long as you follow that process onwards. Police have been another provider. Police have been involved in 22 incidents, although many were not reported to CQC as required. So having police involved in the incidents, it obviously is generally quite serious. But even at that point, there was no trigger or alarm for that provider to say, and now notify CQC or whatever legislative body it was. So again, it comes back to that system. So that is extra work. If you have a system which it lags time because you need to then get it onto an Excel sheet, or it's difficult for staff to engage with because it's paper systems, or it's difficult to timescale it because there's no alerts or alarms or reminders to say, and now you need to do this, or this is outstanding, or we haven't closed that incident down yet because the relevant professionals haven't been informed, or the family member hasn't been informed, or whatever. If you don't have those alarms, it becomes very difficult and it becomes an administrative burden. And I think that is where a lot of the providers are having problems with, just managing the amount of information that now needs to surround an incident. So the reason I've included that line there is incidents are serious enough to include the police, but still there's no trigger for that provider to say, and now inform CQC as per the regulations. And then that last point there, lack of enough skilled and experienced staff and poor clinical leadership meant a culture of restrictive practices that had not been identified or dealt with. That organization couldn't answer the question, how many times have the people you support been restrained? They weren't able to answer that question. And that's really poor in this day and age. We should be able to do that. And again, this is one of the things that iplanit can help with in terms of the module. So you can see by having this centralized cloud-based system that has different levels of recording and reports, you can very easily meet your requirements whilst also learning from that recording of the incidents. I won't go into too much detail, but what this slide is saying is basically at the point of support, if we're capturing things at the point of support, and we're keeping everybody included through communication that is prompted by the system. It tells you if you need to speak to family members. It tells you if there's care managers that need to be notified, and so on and so forth. The knowledge that the service users, the person supporting the patient and the carers have the knowledge that the incidents are being recorded and learned from, and they've guaranteed that communication. That improves their confidence in the system. For the actual where the support delivery is happening, being able to report things easily and access those reports and have prompts and reminders to communicate with family, or prompts and reminders to complete an interview, or prompts and reminders or places to centralize all the information, such as if there's any photographs that need to be taken, if there are any documents that need to be scanned, if there are any interviews that need to be recorded, putting that all in one place instead of in a physical file on a shelf somewhere that not all the right people have access to. That really improves the recording of incidents. And then at the leadership level for managers and funders, making sure that the compliance is in place, getting a big picture view of incidents, reports by area, support type, by individual, in easy to understand reports. So centralizing it, putting it into iplanit, the administrative benefits of that just go on, and then it informs leadership as well, and you get that bigger picture, and you can start to see if there's a pattern in incidents. If, for example, there are incidents when this particular staff member comes on, or if there are incidents when a family member visits, and we need to think about how we support the person to engage with their family in their accommodation. Whatever it is, having this place, having all the information centralized, having it all in one place, being able to look at it on an individual level to see if there are any opportunities for learning and to improve support, and being able to see it on an organizational level to see if there are any leadership issues, such as training, such as making sure compliance is being met. There are a periphery of benefits, soft benefits that come from putting it all onto iplanit. So that gives that the iPlan. The idea with the Instant Manager is it gives you a whole system approach to instant management and essentially learning. You have a dashboard, which Lisa Jane is going to go into a lot more detail, but you have that dashboard list of events there and on the right hand side, and on the left, lots of different things you can do with that. You can view it, update it, archive it, add media, change its status, make logs, and so on. So you can see there's quite a big menu of things you can do with incidents. Through those logs, you can build a team around the incident. So if there are a number of people that have to be involved in recording the incident, then you have a log there. So that one in the center shows the log, which again, Lisa James is going to kind of go into. So anything that happens with the incident, we can make a log about it, whether it was witness details, whether we've created the incident, gives you a timeline of everything that's happened. And for managers in that bottom right there, they can audit it as well. So anything that happens on the incident, they can print off or turn into PDF, an audit log. And then on the left, you can add media. So there's an X-ray there, for example, but you can add picture media and so on. So you can really build, the team can work around the incident and add things to it as the incident progresses through to completion. How you report incidents, we tailor that to how you report incidents at the moment. So not every organization is the same. We all deliver different types of support. So we would tailor the recording forms, where to record the incident, how to record the information that's needed. We tailor that to your organization, which also has a back-end effect on the reports as well. So your reports can be quite specific to your organization. So it's just a quick look at the reports, and Lisa Jane's going to go into some more detail here, but just to give you a quick view, they're quite easy to use. You can drill down into them, you can export them into Excel, and so on.